Hello friends, I am Dr. Diksha Dixit, Cosmetic and Plastic Surgeon and co-founder of the Aesculpir clinic at GK1. और आज हम बात करेंगे ब्रेस्ट ऑगमेंटेशन या ब्रेस्ट एनहांसमेंट सर्जरी के बारे में। बहुत सारे हमने वीडियोस बनाए हैं ब्रेस्ट सर्जरीज को लेके, स्पेशली ब्रेस्ट ऑगमेंटेशन या ब्रेस्ट एनहांसमेंट को लेके, बिकॉज ऐसे हम पे बहुत सारी क्वेरीज आई थी कि मैम हमें किस टाइप की सर्जरीज हम ऑप्ट कर सकते हैं स्पेशली फॉर एनहांसिंग द ब्रेस्ट। एंड देयर वर आल्सो क्वेरीज कि प्लीज़ हमें प्रोसीजर रिलेटेड कोई केस स्टडी आप दिखाएं। तो आज हम ऐसी ही 2 केस स्टडी डिस्कस करेंगे जिनमें हमने 2 तरीके का ब्रेस्ट एनहांसमेंट किया है। दोनों पेशेंट्स डिफरेंट एज ग्रुप्स के हैं, डिफरेंट उनकी रिक्वायरमेंट्स थी, तो हम एक एक करके उनकी रिक्वायरमेंट्स आपसे डिस्कस करेंगे एंड देन वी विल टेल यू हाउ वी एग्जामिन द पेशेंट एंड व्हाट काइंड ऑफ सर्जरी वी ऑफर्ड टू दैट पेशेंट। So let us start with case 1. So case 1 was a young female who had developmental problems of breast. उनकी ब्रेस्ट जो थी एक एडिक्वेट साइज की नहीं थी और डेवलपमेंटली ही हाइपोप्लास्टिक थी, यानी कम फॉर्म हुई थी। वो एडल्टहुड अटेन कर चुकी थी अपना एंड उनको डिजायरस था एक नेचुरल लुक। शी हैड गुड हाइट एंड शी वाज अ गुड एथलेटिक फीमेल। जब वो हमारे पास आई एंड शी वाज वेरी बॉदर्ड दैट शी यूज्ड टू लुक फ्लैट चेस्टेड एंड बिकॉज ऑफ दैट वो एक प्रॉपर क्लोथिंग नहीं पहन पाती थी या हर बारी कॉन्शियस फील करती थी। उनकी ये प्रॉब्लम प्योरली कॉस्मेटिक होने के बावजूद was very mentally disturbing to her. As a young female, she wanted to wear particular kind of clothing which she was not able to wear because she was not having an appropriate breast size. She had to wear padded bras and sometimes double padded bras to attain that voluminous look of the breast and to wear that particular kind of clothing. She was mentally very disturbed because of this. When she came to us, हमने उनको examine किया and we saw that her development of breast, the glandular part, जो gland वाला element है वो बहुत अच्छे से develop हो गया है। Breast almost बराबर दोनों same size की है, but yes, उनकी पास breast में volume नहीं है। Breast की जो shape थी वो ऊपर के तरफ या upper pole पे flat थी और उनका जो वॉल्यूम था वो कम था, बट निपल की पोजीशन उनकी आइडियल थी। शी ऑल्सो वॉन्टेड टू हैव अ प्रॉपर क्लीवेज सो दैट शी कुड फ्लॉन्ट दैट। इन सबको एग्जामिन करने के बाद वी ऑल्सो एग्जामिन्ड हर चेस्ट सर्कमफ्रेंस, हर बॉडी हाइट, हर बॉडी प्रोपोर्शंस, हर लाइफस्टाइल एंड ऑल्सो वेदर देयर वाज फैट अवेलेबल इन हर बॉडी टू पुट इट इन हर ब्रेस्ट। After examining everything, after knowing her needs, we offered her that you should go for fat grafting of the breast. Now what is fat grafting of the breast? Essentially, जो आपकी body parts like thighs, like abdomen, your tummy, your flank regions, your hip regions, जहाँ fat essentially ज़्यादा होता है in proportion to other parts of the body, वहाँ से हम fat निकालते हैं और उस fat को process करते हैं under sterilized conditions and we churn them into microparticles and inject them into the breast in different levels of the breast to enhance the breast. इस breast enhancement technique को हम कहते हैं breast enhancement by means of fat grafting. Now fat grafting gives a very natural looking result because it is your own body tissue. We also made her aware that sometimes in one single stage you cannot achieve your desired look. So essentially sometimes we might require to do fat grafting 2 times or maybe 3 times at an interval of 3 to 6 months so that you can get your desired volume. And she was okay with it because her professional requirements were not as such and she wanted to have a very normal, natural looking breast. After first stage of fat grafting, we waited for some time, gave her certain precautions which she was very compliant with and followed completely. She was to wear supportive bra without any underwire bras for some time and had to restrict certain sport activities. After 3 months, we followed her and whatever results we are showing you is after 1 year of follow-up of the single stage of fat grafting procedure. She was happy of attaining that volume which she wanted for her breast, so she did not go for any second or third stage of procedure. This is a case in which the development of the breast was normal, but the volume of the breast was not appropriate or not up to the mark according to the client. Now there are cases in which the breast is not developed. More so, one side of breast may not be developed or may be asymmetric. In such cases, we do offer fat grafting, but it is important to tell you or make you aware that we might essentially require 2 or 3 staging or maybe more to give you a desired look and give you that proximate symmetry with the other breast. Then comes case study 2. Case study 2 was also another young female. She wanted to have a very voluptuous looking breast with good cleavage, but she did not want to go for stage procedures. She was a very lean, thin female. She did not have much fat in her body, and also the breast was developed, but it lacked volume and was a little bit saggy as well. This female was a married female who had given birth to children, and her breast was a little bit saggy with loss of volume. So she wanted to retain good volume of the breast and have a good cleavage, but she did not want any stage procedures. So we offered her breast implants. Now breast implants are silicone based implants which are foreign material, but they are 4th or 5th generation implants which are very safe and are inert material. These are essentially put in the breast by giving small incisions either in your fold or along the nipple areola or in the axilla and inserted just below the breast tissue or just below the muscle of your breast tissue. Essentially to give you volume and also to lift up the breast and give you certain kind of cleavage and upper bone fullness. This is also opted for females who have professional requirements for the same. This female was very happy with the size of the breast. Now how we measured what kind of implants would best suit her, we sat down with her, we told her that there are different kind of implants which may range from smooth implants to textured to micro textured ones, but all of them are going to be 4th to 5th generation silicone implants. There are certain surgeons who also offer saline implants, but it is the preference of the surgeon of what type of implants they want to put in the patient. Essentially, the covering of the implant remains silicone based. There are also round implants and anatomical implants. According to the requirement and what the patient will best look after surgery, we decide whether we have to go for a round implant or an anatomical implant. In this patient, we did put a round implant just below the breast tissue or fascia of the breast tissue. After implant surgeries, you need to have restriction and exercises for about 3 weeks and then start gradually with exercises, especially the chest muscle exercises under the supervision of your surgeon. All these instructions were given to the patients pre-operatively and then she was compliant with the same. The results which we have shown you is after 1 year of follow-up after breast implantation. The idea of showing you both the breast enhancement surgeries is to help you make a decision for yourself as to what kind of surgery you want and what kind of look you want so that you can decide the surgery for yourself. Before deciding the surgery for yourself, you need to know the pros and cons of both the surgery, sit with your surgeon, sit with your expert and decide what will best suit you. So please have a thorough discussion with your surgeon before deciding of what kind of breast enhancement surgeries you want to undergo. If you have any questions regarding breast enhancement surgeries, breast implant surgeries, fat grafting, or you need to know more about any of these procedures or any breast surgery related procedure, please do feel free to write to us. You can pin us on YouTube also and can follow us on our Instagram handle. You can also contact us on the numbers given below for any further queries. We will be very happy to help you. Thank you.